Hello everyone. My name is Kushi Arora and my student ID is 162666234. I am presenting Capstone Project Part 3 with my group mates Harpreet, Navjot Kaur and Jyoti Devi.
Hi, my name is Harpreet and my student ID is 164289231.
Hello, my name is Jyoti Devi and my student ID is 1655252239.
My name is Navjot and my student ID is 162664239.
So today our topic for Capstone Project Part 3 is fall prevention in long-term care homes. First of all, why we have chosen fall prevention as our topic? The percentage of residents who had a fall in 30 days in long term care has increased from 14.2% to 16.5% according to Health Quality Ontario in 2023. So, why it is a Canadian healthcare issue? Because nearly 50% residents who are entering long term care homes, they require high level care needs according to Ontario Long Term Care Association in 2024. So, according to OLTCA, also, the residents who enter long term care homes, they first of all have complex medical needs, they require daily living support, they have 75% of medications that can cause dementia to them, and fourth is cognitive impairment. So, it can result in cognitive issues like dementia and delirium. Next is why it is a Canadian healthcare issue. So, in Canada, falls result in higher morbidity and mortality ratios, which lead to serious injuries, which include hip fractures, head injuries, etc., and they require a long term hospitalization. So, what are the solutions to this issue? First one is providing monthly fall prevention training to the healthcare professionals. Second one is introducing virtual reality training for healthcare workers. And third is using radar based smart shoes for residents. So next one are evaluative outcomes, which will be covered by my group mate Jyoti.
So for evaluation of fall risk, we're going to use two methods, quantitative method and qualitative method. Quantitative method include pre and post intervention rating scale. Second one is injury rating scale. Third one is mobility assessment for the residents. And qualitative method include three reports: resident and staff feedback, observational study, and incident report. Next one are barriers. Barrier in fall prevention. There are four barriers which are we using for according to statistical data: staff, resident, and training, resource allocation, residents compliance and engagement, and last one is environmental factor. For example, physical stimuli. Next one, how we can overcome these barriers. There are many strategies which we can use to overcome these barriers, like training and education sessions, budgeting priorities, positive reinforcement and involvement of staff, reducing the medical expenses and liability risk through administrative support, resident education and their involvement, regular maintenance scheduling, and last one is non-slip flooring and with improved lighting. Next topic will be continued by Harpreet.
Thank you, Jyoti. So my topic is impact on staff leadership and patient, clients, and family. So the first is impact on staff and enhance job satisfaction from improved resident outcomes and reduce stress. The next is impact on leadership. It helps to increase the facility reputation for the quality care and the safety practices. Next is the impact on residents. It improve the quality of life and reduce their fall risk. Next is the impact on families. It increase confidence in the care provided, reduce anxiety about their loved ones. Next is sustainability plan. For the next 5 years, we aim to reduce fall prevention rate by 5 years, in which we include continuous quality improvement plan, staff training and education about their like virtual reality training and radar based smart shoes. Next is data collection and assessments of the falls and the collaboration and communication among the other healthcare staff members and then residents and their family members. The next slide will be discussed by Navjot.
So the next slide is about leadership style. First of all, formal and informal leadership. Formal leaders oversee managing the budget responsibilities, while the informal leaders seem as incredible and influential by their colleagues in implementing change and evidence based practices. The next one is democratic and transformational leadership. Promote a top notch work environment and safety culture for staff and patient. Decrease patient mortality rates. Next slide. So the next is Levin's theory of change, which include three stages: unfreeze, change, and refreeze. In unfreeze, supporting and educating residents and healthcare professionals about the risk factor and consequences of the falls and the importance of fall prevention measure to prepare them for a change. The next slide is change. Interventions include monthly training session, virtual reality training, and introduction of the radar-based smart shoes for seniors. The third stage is refreeze, which include change is reinforced and stabilized to make it a permanent part of the organization. Next slide. It's about resources that are required to sustain these changes are human resources, which include trained staff, technological resources, which include radar-based smart shoes, virtual reality equipments. Third is financial resources, budget allocation. Fourth is education resources, which include training program. The last one is evaluation and monitoring tools, which include data collection and the feedback mechanism, in which we go to know about our mistakes. And these are our references. Thank you.